A guide to recognizing and managing pelvic adhesions. Recognizing and managing pelvic adhesions is crucial for individuals experiencing related symptoms or undergoing pelvic surgery. This video provides information on identifying the signs of adhesions and offers strategies for effective management and treatment options. Adhesions are bands of scar tissue that form between internal body surfaces that are usually separate. They develop as the body's natural response to tissue disturbance caused by surgery, infection, injury, or radiation. The most commonly affected organs in or near the pelvic region are the fallopian tubes, uterus, ovaries, and bladder. During surgical procedures or as a result of infection, the protective lining inside the abdomen and pelvis, the peritoneum, can be damaged. This damage triggers inflammation at the site, leading to the accumulation of pus cells and fluid. Over time, they combine and solidify, forming a scar similar to what you might see on the surface of a typical wound. Adhesions are commonly formed as a consequence of prior surgical procedures. However, they can also develop after pelvic infection, particularly in cases of advanced endometriosis. In rare instances, adhesions may even cause a blockage in the bowels, resulting in a condition known as intestinal obstruction. Adhesion-related disorder, ARD, is a collection of symptoms caused by the presence of adhesions. A common symptom experienced by people with ARD is persistent abdominal pain. As previously mentioned, adhesions form shortly after surgery, but the symptoms can persist for months or even years. The pain may be localized to a specific area of the abdomen, but it can also be widespread, vague, and cramp-like, making it difficult to pinpoint. It may be accompanied by gynecological problems, further contributing to anxiety and issues related to self-esteem. The symptoms can sometimes be mistaken for signs of other conditions. Some possible misdiagnoses include chronic fatigue syndrome, endometriosis, irritable bowel syndrome, fibromyalgia, and depression and anxiety. However, diagnosing pelvic adhesions can be challenging. In most cases, a doctor cannot feel them during a regular pelvic examination, and imaging tests like ultrasound, MRI scans, and CT scans are not very effective in detecting them. One of the most reliable methods used for identifying pelvic adhesions are a comprehensive medical history and a thorough pelvic examination conducted by a knowledgeable gynecologist who is experienced in evaluating pain-related issues and other symptoms. It is crucial to have the procedure conducted by laparoscopic surgeons who have received specialized training and possess experience in this specific type of surgery. Evaluating whether surgical treatment of adhesions would be beneficial or not often requires the clinical expertise of physicians who have received training in pain assessment. The most effective outcomes are achieved when surgery for adhesions is combined with a comprehensive approach that addresses all aspects of the person's pain. Individuals experiencing symptoms of adhesions may consider laparoscopic surgery as a treatment option. Laparoscopy is particularly preferred for infertility surgery because it lowers the risk of new adhesions forming. Laparoscopic adhesiolysis, which is the surgical removal of adhesions using a laparoscope, greatly improves the quality of life for women with chronic pelvic pain caused by adhesions. Following adhesiolysis, an additional treatment known as adjuvant treatment, often using products like Intercoat, is beneficial in preventing the development of intrauterine adhesions. Laparoscopic adhesiolysis provides a promising approach to recognizing and managing adhesions, allowing individuals to recover quickly. Adhesions are also treated using pharmaceutical drugs or by inserting a physical barrier directly at the site. The latter approach is considered more effective as it directly targets the problem area. This method has become widely adopted in healthcare worldwide. However, the currently available commercial adhesion barriers have some drawbacks. But once it comes into contact with a wet surgical tool, it becomes sticky and adheres to the tissues effectively. Another barrier option is only approved for use in specific applications where there is no bleeding involved, such as gynecological surgeries. This barrier has a structure with tiny pores that can lead to adhesion in areas where there is blood present. Recognizing these limitations and considering alternative options that can overcome these shortcomings is important in managing adhesions. Adhesions often do not show any symptoms in many cases. But if symptoms occur, the most common one is chronic abdominal pain. As such, seek immediate medical advice from a gynecologist in Singapore for proper diagnosis and treatment.